Hi everyone, I'm Alyssa Loss, and I'm going to be talking about my final video presentation. Starting off with my cleaning log on the treatment table, I found errors within the type of injury and the cost CMS, both with improper formatting. The cost CMS came from some not having dollar amounts attached to it and the type of injury. There was a difference in formatting of unknown injury versus injury without a tissue type. So I was able to continue and uh, keep that format together. With on the injury tab, I had a few. I had the eval date being prior to the date of injury, so I was able to change that. The days to eval with those being negative, so I was able to equal it out to zero. The prognosis formatting being different, where some were typed out weeks and others had abbreviations, so I switched that all to the abbreviation. And the injury severity, we had some first and third degree injuries on there, so I was able to change that to mild and severe. On the patient tab, I had two with abbreviations and with sport and sex, so I was able to change that and keep it all the same formatting. And lastly, with the referral, I was able to change how the provider was listed out with the formatting and the referral type. There was some misspelling in there as well. So moving on to my first trend, the first trend that I discovered was that ankle and knee injuries are the most common across all sports, specifically most in basketball and soccer. And this suggests that lower extremity injuries are a major concern across multiple sports that do involve the typical motions of basketball and soccer, like running, cutting, jumping, and especially those rapid changes of direction that can be very hard on those joints. The clinical intervention that I wanted to include for this trend is that ankle strengthening and mobility exercises. The expected outcome of this intervention will be a reduction in the ankle injuries in the population of both men's and women's soccer and basketball athletes. The second trend that I discovered was that sports with higher injury counts generally do require more medical interventions. The sport with the most injuries is football. And with this injury volume increases, that typically means that athletes require more follow-up care, rehab treatments, and also specialist referrals as well. The clinical intervention that I discovered to reduce those injury counts within football to therefore lead to less medical intervention would be relying on comprehensive neuromuscular training. And this can include incorporating warm-ups, strength and balance, core stability exercises, all within a structure to help try and reduce those um, injury numbers as well. And then a reflection on the AI use that I had. I did not run into any issues with the AI when was able to use the AI to help find both of these trends. I checked it with both pivot tables and I was able to confirm the numbers with that. So that was good and helpful for me. And um, one data gap that I do want to know that I couldn't find too much on in this data set was really long-term injury rates and recurrence based on like some of these sports that do have a lot of um, injuries in any way, shape, or form, how that looks over a more long-term um, period of time. Like, for example, if an athlete is playing this sport all 4 years of high school or 4 years of college or so on, just how the injuries look on a more long-term scale versus this was a little bit more on a shorter scale. So that is a data gap that I was very interested in looking into at some point as well. Thank you so much.